By a show of hands, how many of you know someone who's been to prison? This topic should be important to you because over 40% of incarcerated individuals are facing mental health challenges. The treatment of mental health problems in corrections is something that has evolved over time. To illustrate this, we'll look at the advances that we have made through mental health in corrections. To begin, mental health care is increasingly defined by clinical specialization and technological integration. Modern evolution and current trends have brought us to where we are today, and we look at milestones and models that have developed to guide us. Mental health care in prisons have evolved from informal, inmate-led to court-ordered mandate structured treatments programs reflecting broader societal shifts and legal interventions. From the Evolution of Prisons Mental Health Services Journal, Corrections Today, Volume 53, Issue 5, 1991, we have models. The early period, the inmate model, which was 1900 to 1975. Initially, mental health care in prisons was informal. Inmates often provided support to each other, included counseling, restraining peers, and dispensing medications. Due to understanding and untrained mental health clinics, this period, known as the inmate model, was heavily relied on peer intervention rather than professional psychiatric care. The lack of formalized services meant that serious mental illnesses were often untreated, and the quality of care varied widely across facilities. The court and rights model from 1975 to the present, landmark cases like Estelle versus Gamble 1976, which established that deliberate indifference to serious medical needs violates the 8th Amendment, and this forced prisons to adopt the minimum standards for screenings and treatment. From the mid-1970s onward, federal courts began imposing standards on state prison systems requiring structured mental health services for inmates. The court model emphasized the prevention or relief of suffering association with serious mental illness and established legal rights to quality care, treatment consent, and appropriate transfers for treatment. Courts also influence staffing, training, and the development of formal treatment protocols, making a shift from informal peer care to professional oversight. We then have rehabilitation and integrated care models. In recent decades, some states have adopted a rehabilitation model combining case management, crisis intervention, and traditional psychiatric management. Modern approaches include integrated care models. Reentry programs and continuity of care cost care post-release, aiming to reduce and improve long-term mental health outcomes. These programs often address substance abuse and trauma, reflecting a more holistic understanding of inmate mental health. For Centers of Prison Reform, July 15, 2014. Next is the screening at admission. And with this, since the 1980s, facilities have adopted formal intake protocols to identify mental health needs immediately upon arrival. The BJMHS, which is the Brief Jail Mental Health Screening, and the Depression of Hopelessness and Suicide Screening Form, DHS, are often used. It involves screening for self-reported mental health history, past hospitalizations, and current psychotropic medication usage is the goal of the screening. The primary aim is to identify individuals at the risk of harm to themselves and others, and to initiate necessary treatments of specialized housing immediately. It acts as a bridge between the community and the prisons to maintain continuity of care for those with existing conditions. They have specialized units and staffing, and many modern prisons now include dedicated mental health units staffed by multidisciplinary teams of psychiatric, psychologists, and nurses. There's trauma-informed care, which recent shifts focus on recognizing high rates of past trauma in the incarcerated populations to prevent re-traumatization and reduce incidents of self-harm. This model recognizes the high prevalence of trauma and among the incarcerated and adjusts facility routines to avoid re-traumatization. Implementation has led to reductions in self-harm incidents and created a safer environment for both staff and inmates. They've also increased staff training. The correction officers are increasingly trained in crisis intervention and de-escalation techniques. Lastly, from mycorehealth.com by Jay Sanchez, April 29th, 2025, the expansion of medication, the use of psychotropic medications has risen sharply. For instance, antipsychotic prescription probabilities in jails increased by approximately 249% between 2013 and 2023. There's telehealth and technology, and telepsychiatry has expanded access to specialists in rural and underserved areas, helping to mitigate ongoing staff shortages. Diversion program initiatives like mental health courts and crisis intervention teams aim to direct individuals into treatment rather than incarceration. Rehabilitation into society, as challenging as reentry process for inmates to general, it is even more for those who have mental illness. These inmates face all the obstacles, but often are at a greater degree of disadvantage. One major contribution to this revolves around the housing concerns. Inmates with mental illness are more likely than those without mental illness to be homeless after release. Common causes for homelessness among these inmates include lack of adequate community-based treatment programs, difficulty obtaining employment, leading to financial inability to support housing, psychotic symptoms, interfering with the organizational abilities required to obtain stable housing, and substance abuse resulting in allocation of financial assets to drugs over housing. In conclusion, the approach to mental health in corrections has come a long way. What was once overlooked and misunderstood issue has evolved to an area that receives greater attention, research, and care than it once did. From the models we look for guidance, staffing, training, and employees, and screening, medications and therapies that we use, the advancements not only help manage mental health illness with the facilities, but also prepare individuals for a more successful transition into society.